Kia ora tātou, no mai haere mai to our Goodfellow Unit COVID webinar series. My name is Katie McCulloch and I'm a nurse practitioner who works in primary healthcare and for the Goodfellow Unit. Tonight we're focusing on how to keep connected to what matters as part of our webinar series from Waitemata DHB and its Specialist Mental Health and Addiction Division. It's aimed to enhance specialist support for primary healthcare and community healthcare providers. The Omicron variant has caused a surge in COVID-19 cases, which is putting additional stresses not only on our healthcare systems, but also on our workplaces and personal lives. We risk burnout and poor mental health from this. This session will look at useful and practical tools for individuals and teams to stay resilient and cope through the Omicron surge and beyond. Tonight, we're going to be hearing from Dr. Willetts, a clinical psychologist at Waitemata DHB with a special interest in fostering wellbeing within teams and services, and Dr. Cheryl Buhay, Fellow of the Royal Australia and New Zealand College of Psychiatrists and an honorary senior lecturer with the University of Auckland. She also works with the Waitemata DHB Specialist Mental Health Services as a primary care liaison psychiatrist. We will also end tonight's session with Dr. Christine McIntosh from the NRHCC with an overview of COVID-19 primary care response updates. Over to you, Cheryl.
Thank you for joining us, and I know everyone is really busy, so thank you for taking the time to attend this webinar. First of all, before I start, I just wanted to say thank you to all you health professionals for all that you've done, especially in the last few months, and in particular the last few weeks. The times have been really stressful, and there are things that are beyond our control. And GPs in particular, and practice teams, you've had to do your usual work, and on top of that, deal with all the COVID related stuff, testing, vaccinations, COVID care, dealing with new IT systems and the rollout of RAT tests. So I just wanted to acknowledge all the work that you're doing at this time. So this is no surprise, but there's a high mental health morbidity associated with COVID-19. And in a CDC survey from August 2020 of 5,000 adults, it found that about 40% had at least one mental health or behavioral health problem. And a significant proportion have other disorders such as trauma and stressor-related disorders. Just over 30% had anxiety or depressive disorders, substance use issues, and suicidal ideation. And in healthcare workers, there is a considerable proportion that experience stress, anxiety, depression, and sleep disturbance. And there is a systematic review and meta-analysis by Lee et al. Very recently that included 65 studies that involved over 97,000 healthcare workers across 21 countries that showed high prevalence rates of mental health difficulties such as depression, anxiety, and PTSD. And even in New Zealand, there's been lots and lots of stuff in the media about GPs facing burnout and high stress levels. And I think there's even an article in the Herald today where GPs are having to face abuse from patients. So I know you guys are facing a lot of stressors in your day-to-day work, and we acknowledge that. So with high stress levels, this leads to burnout, which is an ICD-11 condition, which is an occupational phenomenon resulting from workplace stress that has not been successfully managed. And this is characterized in 3 dimensions, such as feeling exhausted, negativism or cynicism about your job, and reduced efficacy. So with high stress levels, that can lead to burnout. And as I mentioned, it can lead to other mental health issues such as depression and anxiety. And if you look at the stress bucket model, we know that burnout and these other mental health concerns happen when our bucket overflows. So to prevent the bucket from overflowing, we have to balance the stressors coming in versus our coping strategy. So those are the taps or the holes at the bottom of the bucket that would prevent water from accumulating. Not only that, but we have to consider the size of the bucket. So each of us have a different makeup. We come from different backgrounds, and the size of that bucket is influenced by several things, such as our genetic vulnerability to mental health issues, our family mental health history, our developmental factors, which includes our early life experience, any trauma that we have been through, and even our physical well-being. And when we look at stress and burnout, there are several factors at play here. So there are individual factors. Like I said, we are all different people. We have different personalities, different sets of values and morals. So values are, what we see as important, like loyalty, honesty, dependability. And morals are the rules we use to decide what is good or bad, like always tell the truth or treat others how you want to be treated. Each of us have different coping styles, and we have different mental health histories, and we face different challenges, in our, earlier lives. Outside of work, we have many different stressors that we face, and those of, who have busy home lives, you have children, you have to grapple with other stresses outside work, with regards to family, childcare. Some have difficulties with finances and feeling socially isolated. And in terms of work-related factors, there's the, having work overload due to having large patient volumes. You have lack of resources, or you feel that your workload is poorly managed. You might work long hours, or it's all fast-paced, like our walk-in centers and A&Es. The sense of there's, lack of control over your environment, and having to spend time that is, inconsistent with your goals. Other factors related to work include high levels of work-home interference, ethical dilemmas in the workplace, or moral injury. So moral injury is when we're expected in our work to make choices that conflict with our values and beliefs. So examples of that will be, having to balance one set of values over another. For example, caring for patients with COVID-19 versus wanting to protect your family, your own family members from getting COVID, or allocating restricted resources to severely unwell patients, and also balancing our own physical and mental health needs, with the need, our duty to look after patients. There's also other factors that some studies have mentioned that contribute to work-related stress. So being female, working in a solo practice, being earlier in your career, or attributing your success to chance instead of your personal accomplishments. And as healthcare workers, there is perceived stigma around stress and mental illness. So we're more likely to not disclose or not access support, and we're at risk of self-medicating our own difficulties. So while we may not be able to control the stress around us, we can use tools that help us cope with stress and build resilience in our day-to-day lives. So this is what this session is about, is what are the tools that we can use to look after ourselves and look after our teams to just get us through day by day through this Omicron surge that we're going through. So Amanda will discuss self-care and go through mindfulness, sensory modulation, and breathing exercises. And after that, I will talk about how you can care for your team and other things like switching, how to switch off from work as you transition from going from work to home. So I'll pass it on to Amanda now. Thank you.
Thank you, Cheryl, for the introduction. So when we're thinking about keeping connected to what matters, I was just thinking that I wanted to start with, I guess, what really matters around what I'm about to talk about and what we're about to do for the next half hour. Is the main point is that what we're going through at the moment across the globe is a stress for all of us health workers, and as humans and healthcare workers, we have to go to work each day with essential nervous systems that respond to stressful situations and threats to ourselves and the people that we care about and the people we work with. And so our mind and our body will respond to that in a way that can take us away from what matters. And so what's important in this talk that we're doing now is about how to stay connected for what's important to you and what it matters to you across this time. And the invitation is possibly through mindfulness and some other tools that might be of use as well. Okay. So we know that Omicron's another wave of COVID as a stressor. COVID isn't completely a stressor. There's been some research that's found that during lockdowns, people fortunate enough to have internal resources that allow them to connect with people that are close to them, and external resources can grow further, such as in areas of quality time together. So the full story isn't necessarily that it's a complete stress, but for us as health workers, we have to deal with increased demand on our time, increased information, increased emails, high expectations, and like Cheryl was talking about, that this moral injuries where our wish for what we can provide for the people we work with is not necessarily what we can always provide with the limited resources at the time. And at the moment in New Zealand, we're still in that active phase as a system where we're still having to work through that adjustment phase of COVID, that we're still learning about it, acting on it, and we're still having our central nervous system on high demand, adrenaline coming through our body, and often we're having to work in a fashion that's in the moment, doing the best we can with the little information that we might have or little resources. So we're still often under stress. The impact on us as humans is that when we're under stress, and many of us know this, you know, our minds change, we've got less access to our frontal lobe if we're highly stressed, our perception narrows, and what can happen is we become more focused on the threat. And these are all based on evolutionary psychology ideas about how to survive, focus on the threat, and we're more likely to problem solve. Our body also responds in a way that it automatically sends out the chemicals to make us react faster. We get physical sensations that we're less aware of that drive us away from unpleasant things or towards pleasant things. All these things happening without our direct awareness, and we can be an automatic pilot, especially during these times when we're still in this active phase of coping with stresses. And these are all really useful things. And I don't mean to say that they're bad things or problematic, but the things that we need to be aware of, because as our mind adjusts in this way, and as our emotions change in this way, and our body changes in this way, we might get changes that disconnect us from other feelings or other experiences or values that we have at other times in our life when we're not under threat. So for instance, at this time in our lives when and I'm a psychologist, I'm not working as a GP, but I imagine there's lots of demand for time and to be seeing many clients and patients. And then I imagine there's lots of pressure on time away from home, but the value for family is still probably present here, but the pressure to be at work might be conflicting in that way. So we might not feel during stress our values of our connection with our partners or connection with our children, and we can be cut off with that, and our mind can become very focused on work and prioritizing that under stress. And I'm not saying this happens for everyone, it's just an example of that, what can happen. So if I just ask you to be willing, if you'd like, just to pause at the moment and to just notice, where are you mainly at the moment? Are you actually in your mind? Are you aware what's actually happening in your body at the moment? What sensations are here, how you're feeling? Where are you mainly? And do you know what's happening in your toe? What's going on there? In your big toe or in your little toes? And in Western society, we've taught that our minds is the most precious thing. Our body's here to carry it around, really. We're not kind of educated or socialized to really value our bodies the same way. But tonight I'll be talking about the importance of actually being in our bodies for wisdom, and also to connect with what matters and to be present here for when we're under stress and how to manage that stress in a way that we're not overwhelmed the same. But I just want to offer an opportunity to do something that's a little bit different. And if you have a cell phone available, if you're not using it right now for Zoom, you can use your cell phone, or you can just use your mind and be creative if you want. But just to take a photo of an object in the room, probably not a person, because you're going to be touching the object and not everyone's going to appreciate you touching them. Just any object that's in reach, just take a photo of an object if you want to, and then go into your gallery and open that picture. Right. Okay. Now, once you just look at the picture and have a look at the object as well, and just see what your mind says about the comparison between the two, and is it a good representation or not of the object? And you don't have to tell me about it. You can if you want. Now, what I'm going to get you to do is have a really good look at that picture. And is it really like the object when you really look at it? Are the colours really such a match? Or is there actually a difference here? Are the dimensions the same? Is the shading and tone the same? And if you were to touch the picture and to touch the object, are they the same? And how do they differ? And we can even listen to them. We can tap the picture and tap the object. And once again, using our senses to really connect with the physical world. Is that physical world really the same as that picture's representation of it? Now, for some minds will see at the beginning here, it is a good representation, and others might have disagreed. But when we really explore the actual world in this moment with our senses and compare it with this representation, it's a very different experience. Now that picture in our phone is similar to our minds. Because of language and our visual abilities, we often have, pretty much every moment, we have pictures and stories running through our mind that we take as a very good representation of what's going on for this moment in this physical world. And because of language and visual abilities and all the rest, that enables us to have a lot of additional stress in our lives and can take us away from what's actually happening in this moment. And I imagine if we even come back to when we get to work in the mornings and we open our emails and we see all these emails coming at us, it can be very overwhelming, and all those emails are thrown at us as if they're of a great importance, because our mind all has that information saying this is all work stuff and this is very important, because that's our central nervous system saying work is important because this is my living, and people are important and this is my living. And yes, that is true, but the emails in themselves are not of equal importance. But our mind is telling us this, and our central nervous system is telling us this. So just what I'm getting at here is where I'm heading is into mindfulness, where it helps us learn to step back and pause and catch ourselves when the central nervous system reaction is taking us away from the present and into the future or into a stress story, and helps us come back to now and to connect to that actual moment and what's happening, so we can act from a wise way, which helps us be less stressed in the moment. Now, often when we have difficult feelings coming through, we have our fight flight playing out, the really uncomfortable feelings, and they're meant to be uncomfortable feelings because it's our central nervous system trying to get attention, saying something's up. Society's kind of taught us, and our evolution's taught us to get control of these things, because we don't know really what to do. And sometimes they're useful. You know, we'll do yoga and that will help us calm a bit. So of course we do some more. But one of the things that I'm offering to consider today is how long does the stress stay away for? Is it permanently gone? Or is this part of being a human? And one of the offerings that I'm putting out there today is what research is finding is that actually when we try and control those thoughts and feelings, it creates a tension that actually in the end keeps them sticking around often. And even if they do move, in the long run they come back anyway. So maybe there's a different way of learning to maybe be with them, take the message, and let the energy burn through so they don't stick around and become a problem. I've got a photo of a wave here, because often when we're in that tension, it's like we're pulled into this wave of stress and we're thrown around by the stress of the central nervous system. And it's like we become the stress, the anxiety, we get obsessed about the problem. These are really normal things to be feeling at the moment when we're overwhelmed by clients, we've got upset clients, we've got upset staff, we're fatigued, we're talking about change fatigue, we're in the active phase of managing stress as healthcare workers. So this is an important time when burnout's starting to show its head potentially. So there's a lot of emotional stuff happening. And now's a really important time to start addressing this wave that is here because we are humans under stress. So when I'm talking about what matters, our mind will say, yeah, hey, this matters, you know, going to work and doing my job does matter. And yes, it does matter. Of course it matters. We do this work because we care and we want to help people. But there's the mind's first answers of what matters. But then there's the heart's answer of what matters. And what I mean by that is, if I were to ask you, what would you like people to stand up and say about you at your 80th birthday party? And how you lived your life and what type of person you were? Maybe just answer to yourself now. What would you like them to say? What type of doctor would you like them to say you were? Just those kind of things, deep in your heart, those kind of things that matter. And the reason I raise those parts is often those values we have connect to things like love, compassion, creativity, caring, wisdom. The reason that they are important is they are other parts of a human experience that give us resilience during difficult times. Through mindfulness, which I haven't explained yet, but through mindfulness, what that offers is an opportunity to step out of the wave and become an ocean. And what an ocean is an expansive, open area of energy that has deep resources within it. This ocean with its resources is big enough to be able to hold these waves. So when we practice mindfulness and we are able to step out of the stress, in doing that, we're more able to connect with the things in our heart that really matter. Things that tend to be compassion, care, love. And when we connect with them, we're more able to be resilient to things like coming into work and finding that there's another change occurring as well. Because we don't have to hold on to control of things, because we're more settled in ourselves, knowing that we'll be okay with change, because we're able to hold these things with love, strength, wisdom. But the question is obviously, how do we do this? So tonight's only a short talk, and this is a bit of a life practice. So this is an introduction, and I'll stop talking soon, because mindfulness is not about talking, it's about doing. But the goal of mindfulness is to be present in the moment with what's happening internally and externally, with the goal of wisdom, of insight. The ultimate goal would be freedom, some would say, that you're okay enough with what's happening that there's freedom to be okay. Okay, so John Kabat-Zinn is well-known doctor in America who's often quoted for how to do mindfulness. So when we're practicing mindfulness, we're practicing stepping back into awareness. And so it's stepping back into kind of like a noticer stance, letting go and just noticing what's happening in the moment. And we'll be practicing it soon, but it's just being aware of things like thoughts, feelings, sound, and just practicing rather than being in that wave, stepping out and noticing there's a wave. And so that's going from being in the wave to practicing to stepping out into being in an ocean stance. And how we do this is by also intentionally, on purpose, starting to pay attention to the moment. And this moment is the moment that matters in our life. And if we're present in this moment and respond to what's happening in this reality with insight, then we're more likely to act wisely and respond well to this context. And the reason that we do it in a non-judgmental way is because often we're in our minds with judgment or assumptions, and that takes us away from reality. So we're practicing instead coming out of our minds, coming back using our senses and observing what's happening so we can see actually what is reality without these biases of the mind. But it's about also coming back to our whole being, because we've evolved with this body and the senses and all the intelligence in here as well to fully to use our full body as information to connect with what's going on. But let's start doing some mindfulness, okay? Okay. So if you're willing, we'll just do a little bit of practice of what it's like to be present and maybe some of the benefits of that or experience of what that's like. And then we'll do a bit of a practice as well, following that on what's it like to step out of the wave and just practice noticing and experience what that's like. And a big part of mindfulness is in the doing, because it's about you and learning through your doing. It's not about me telling you how it is. Okay, so it is an alert, aware stance. So we're not just sitting here and sitting back. Comfortable, we're not trying to make things happen or force things to go away, but comfortable but upright position. And you can have your eyes open but softly down or closed, whatever works for you. Now, mindfulness is about being with what's here, but if you're noticing that you're really tense and it's hard to kind of get your focus to be even here for a second, it's okay to use some of the diaphragm breathing to help settle down your central nervous system enough to start being here. So we'll start out with actually diaphragm breathing. So what I'm going to get everyone to practice, if you're willing, is that intentionally slowing down the breath to a count of 4 or 5. So breathing in, 1, 2, 3, 4, and hold. And out, 1, 2, 3, 4. Now we'll just do 3 more breaths, just slowing down our central nervous system for those who might be tense. And out. And 4 count in. And out. And last breath in, 1, 2, 3, 4. And out, 1, 2, 3, 4. Okay, now let's change over to mindfulness, where it's about being here with whatever's here just for this moment, because we just want to be with whatever reality's here so we can see it clearly. But that means that we have to get used to allowing difficult thoughts and feelings to be here too, so we can see clearly. But we need to have an anchor to do that because these feelings can be tough. So let's just practice being present with the breath, not changing our breath or changing our thoughts or anything. We're just practicing focusing our mind to the breath. And we do that by just noticing what the physical sensations are as our breath comes in and out of our body. So you can choose one part to focus on, practice focusing on. That can be in your nostrils, noticing cool air come in and warm air go out. Or you can notice what the entire breath feels like as it comes in and out of your body. So you might notice the sensations of your stomach moving. There might be tingling. There might be stretching. Now your mind will wander because our brains have evolved to do that. We're not trying to stop that. It's just about noticing that's happening and practicing bringing your focus back to right now, which we're doing by focusing on the breath in this moment. Just noticing what it's like to just be able to focus just on this moment, on this one task at hand. Practicing focusing on this present moment's task. And noticing what it's like to just be here right now. Okay, now we're going to try something different. We're going to practice stepping out of our thoughts and feelings being us to noticing that thoughts and feelings are part of us. But we're going to step back into noticing them and not being them. And we can practice doing that by just imagining that we're sitting on the side of a river, and any time that says a thought comes along, or a physical sensation in your body like heat or tingling or coolness, or any feelings come along, you can just imagine that there's also a leaf on that river floating past. And although you're not trying to hurry the thought or feeling away, you're just going to put your thought and feeling on the leaf and gently put it down on there and just let it be, and come back and sit on the river. We're not trying to get rid of the thoughts or feelings. It's just if any pull us away, we can notice they're doing that, and we can just grab them and put them gently on the leaf and sit back. But otherwise, if they're not pulling us into them, we can just sit back and watch our thoughts and feelings as they come and go. And if we don't want to put them on leaves, we can just name our thoughts as thoughts. We can just name our feelings as feelings, and physical sensations as physical sensations. Much the same as the ocean can just see a wave come and say, hey, there's a wave. And because we're all human, our minds and feelings will pull us into some story at some time. It's just noticing that without judging ourselves, and reminding ourselves about why we're here to practice, and bringing our focus back to whatever we're practicing at the time, whether it's the leaves or the naming, or just watching the thoughts and feelings go past. Now, another important part of mindfulness is compassion, because sometimes it can be very painful feelings or thoughts that we have, and it can be very raw to sit with that, and so it can be very important to come with compassion towards ourselves when there's pain here. So if you notice that there's some pain here, you might be willing to try and bring some compassion. For instance, if you're feeling some stress from work, with there being lots of pressure or change with Omicron, you might try being compassionate by acknowledging that, oh, it's stressful at the moment. And you might want to remind yourself that you're not alone with the stress, that there's many other people in healthcare also struggling with the stress of another wave of COVID. And with the care of compassion that we provide others, we can practice listening to our stress and giving ourselves what we need with some kind words. And it may be, may I be kind, may I be strong, or may I be compassionate, whatever feels right for you. And when you're ready, opening your eyes and just raising your eyes. And just maybe taking a moment to just think of, acknowledge or notice what it was like to try some of that. So there were 3 different things that we practiced there. There was the diaphragm breathing if we're feeling overwhelmed and if mindfulness is feeling a bit hard to do, because sometimes we can be overwhelmed. There was a bit of experience with mindfulness, and we tried a self-compassion practice at the end. If diaphragm breathing isn't preferred, we can also try sensory modulation to help calm us if we're overwhelmed. And Cheryl has got some handouts that she will provide as well. So we can use our senses, like our touch and smell and hearing, and all those to help soothe our central nervous system. And it's much the same as how we can be irritated through our senses, such as horrible noises or horrible touch. Our central nervous system can be soothed by nice, soothing sound and soothing touch and those kind of things. So we've developed a worksheet to guide that a little bit, that you can explore with some ideas on it as well in your own time. So this is just a little brief on some ideas, and there's also further guided mindfulness on the home worksheets that you can try as well with different strategies as well. So thank you for your practice.
All right. Thank you, Amanda, for that introduction on mindfulness. I'm just going to go through quickly. I know we don't have much time left this evening, but I'm going to go through some tools on how we can care for our teams during this time of stress. So some tools include, acknowledging and validating, being realistic of our expectations, improving our connectedness at work through checking in and emotional coaching, being kind to one another through showing gestures of kindness, providing support, and also caring for yourself, because it all starts with you. In terms of acknowledging our experiences helps us calm our nervous system. So by doing that, you can do that by validating verbally that everyone's experience is different and everyone's experience has value. Naming the emotion is helpful. This is frustrating. This is making me exhausted and angry. It helps us feel seen and heard. And be transparent about the uncertainty of what the future may bring in terms of future disruptions and how it can impact on us all. Be realistic as well with your expectations of each other, of one another and yourselves. Don't expect perfection, and encourage your colleagues to do what they can, and then that will have to be enough at this time. Connecting with one another is important. So through connecting with one another, it reinforces how much we've been through and how much we've accomplished together. So encourage people to check in with one another at work during the day to make sure they're okay and they feel supported, and also model by listening and understanding that concerns that your colleagues raise, and if possible, you can address these. You can improve the connection at work through checking in. So this is where you can have scheduled meetings, team huddles, or handovers, and checking in would help your team reconnect on to purpose, be more engaged and cohesive. So you may choose a prompt during a check-in, and then you can go around the group and they can respond as brief as needed, because also, you were all really busy and you guys are flat out in your practices. So you have to keep it organized, professional, and relevant. And it would depend on, the time availability and the general mood of the room also. So some examples of check-in prompts would be, what's a high and a low from the day? What is the one thing that went well today? What is the one thing that you are grateful for right now? What is one thing that is giving you hope? What are you going to do for yourself, something positive after you leave work? You might give a shout out to a colleague for something that they have done well. So these are just examples of what you can use as prompts during a check-in. The second one as tool to improve connections within the team is through emotional coaching, which its goal is to validate the person's experience and to promote positive peer support culture. So first is self-disclosure. So a colleague may share some information with you. And in doing that, even if it's something very common, like if they say, isn't it a great day? Isn't it a great day today? Isn't it great to have a sunny morning? That shows a moment of vulnerability in your colleague. So through validating what they say, even if it's a simple reply, yeah, it's really nice out there. Yeah, I agree. It's really sunny. The person feels heard, and that improves the sense of connection with that person. So it improves resilience with in your relationships with one another. And how you validate emotions is through reflection. So you share back what the person says. It's like you're a commentator in a sports game, or like you're wondering what's going to happen. Or you might name the emotion, and that acknowledges the emotion that your colleague is feeling at the time. Oh, that sounds really stressful, or that sounds really frustrating. You might get curious and ask them to tell you more about what's going on for them. Oh, so how are you doing with this? Tell me more about that. And it takes practice, but if we can speak to one another in a validating way, that improves our well-being, our connectedness, and our resilience as a team. So examples of validating statements would be, instead of saying, oh, that sounds really tough. Instead of saying, at least you have a job, say, oh, that sounds really tough. Or you might say, oh, that sounds really frustrating, rather than, oh, you'll get over it. Or you shouldn't feel that way. I don't know why you're so upset. You should be more positive. Because once, we say something invalidating to another person, that can create a spiral of, lowering of mood, increased anxiety in our colleagues. So maybe when you go to work tomorrow, try and communicate in a validating way by using reflection, naming the emotion, or asking open questions so that your colleague can share more of their experiences. Gestures of kindness. We hear just in saying be kind. It's no surprise, kindness can help with our emotional well-being. It improves self-esteem, improves support networks, reduces isolation and sense of belonging. So, and I see from the practices that I visit that there's kindness everywhere. It doesn't have to be food. It doesn't have to cost anything. It can be as simple as saying hello, saying thank you, praising someone for something they've done, being there to listen to another colleague who's having a bad day, or speaking to someone who you normally wouldn't speak to on a normal day. So you don't have to splurge to be kind. And if you can have kindness at work, the more the better. Another one is, support. So you can use these tools at work, but you'd need extra support. Some people would need extra support through the use of other resources, which could be through EAP. So Medical Protection, Medical Assurance Society, and the PHOs would provide EAP service to their staff. There's helplines, so the 1737 number you can call or text, and there's a counselor on the other end, so your staff can access that. There's community resources like that provide counseling, sensory modulation, and our service provide specialist mental health input as well. So even if it's through a simple advice, or if someone who's mentally unwell and needing specialist follow-up, then we can be involved. And we're not only talking about support through on the mental health side of things, but you need to consider other supports that are needed. Like as we looked at the stress bucket and the different stressors, there are stressors outside of work that can occur. So finances, childcare arrangements, food, can you offer flexible work options, ensuring that recruitment and retention are the focus, and it's not neglected, because if you're down on staff, they'll get burnt out. So I know practice managers are quite proactive, especially these days, especially like in our service. We're always looking for cover because the doctors we have are so stretched at the moment. And lastly, it starts with all of us, all of ourselves. And if you at work are talking about, oh, this is how I'm looking after myself, this is how I practice self-care, then it makes it okay for your colleagues to be doing the same for themselves. So engage in discussion around self-care at work, and foster that culture within the workplace, and that would be helpful for the team. I got asked by a GB colleague about how to deal with anxious patients and dealing with distress. And you've got people who come up to the practices highly stressed, they're angry, they want their rat, they can't find anything. And this is something that you can just remember, that's a useful tool for de-escalating with compassion. And it uses the same principles that we've already mentioned in the earlier presentation. So N is naming that emotion. So name how the person is feeling. It makes them feel validated, understand why they're feeling this way. So try and explore, show the respect for how they're feeling, and try and raise the positives that this person, the positive factors. So it skews their attention to something that's more positive. Like if someone is distressed, you can say, look, you've done so well despite the situation, or you've done A, B, and C to help manage, so they can actually redirect their thoughts like, oh yeah, it wasn't actually all that bad. And by that time, the person is starting to de-escalate. S is for support. So make them feel like they're not doing this on their own, that they've got you or primary care team to support them through their struggles, and explore the next steps and anything else that might be any remaining questions that they have. So those are some tools that you can use within the workplace. I wanted to cover just a little bit about switching off after work, because we're probably not very good at doing that. And I personally, I don't think I'm the best as well. But this is a checklist that might be helpful. So as you're switching off work, do acknowledge one thing that was difficult that happened in the day. Name it to work through it, and then let it go. List three things that went well. So you got to celebrate your victories. So it's not all terrible. Check on your colleagues before you leave. Make sure that they're okay, and reflect on how you're going too, because your needs are valid. And then you can start switching off and redirecting your attention to home, where you can rest and recharge and focus on things that are important to you. And as you're switching off, you might want to use a CBT tool called the worry map, where it's a task that you can, let go of your worries, take back some control by making a plan and finding a way forward in challenging situations. So you might want to write down, what are you worried about? Is it true or false? List the things that you can and cannot do about it. What is beyond your control? And create an action plan of the things that you can do, things that you can control. And then after that, you can let the worry go. And so you're just detoxing yourself from all the worries as you leave for home. Aim for a smooth transition between work from home. So you're going from work mode to relax mode. So try to not do too much worrying about work or making work-related phone calls, which is, I know, hard for a lot of you guys. Do something that you enjoy, whether it's listening to music, doing some breathing exercises like what Amanda showed. Visualize how you're going to relax when you get home. And if the commute is short, you might want to just take 5 to 10 minutes before going back home to just take time for yourself and just reflect. And that really helps lift the mood and de-stress. Create an after work routine. So I don't know if you all have your routines once you finish working in your practices, but making coming home something to look forward to, and that's very important. Fill it with things that you love. So it could be as basic as having a nice hot bath, or having something, a drink, or walking in nature. And consider having some space for yourself when you get home. Like even 20 minutes, it can improve your state of mind. And this is particularly important if you live with other people, and especially young children who just want every bit of you as soon as you walk in the door. Take time to breathe. So, at least twice a day, practicing the deep breathing. It also helps with insomnia. If you struggle to get to sleep at night, there are some useful apps out there as well. So Mentemia is one of the apps that are endorsed by the Ministry of Health, and it's co-founded by John Kerwin. So I do recommend downloading it if you haven't. And that can help with those breathing exercises as well. Do something you love. Aim to do this after every shift. This will give you something to look forward to and distract you from work stress. And as basic as it sounds, plan for laughter as well, because that helps us cope, relax, and recharge at the end of a stressful day. So these are the tools that Amanda and I have covered today, and these will help us cope with stress from the day to day, especially when things keep on changing around us and we don't have control of all the events that's occurring around us. And I hope that you do feel after this encouraged and motivated to give these tools a go, whether it's just one or whether give a few of them a go. Try some mindfulness, or you might want to look at some sensory tools that you can use at work, at home, as you transition from work to home. What are the things that you can use to reduce your anxiety through the different senses? How can you improve your sense of connection at work? Is that happening well? Can that be improved? Have you looked at how you switch off from work or your after work routine? So I encourage you all to just reflect on these things. And Amanda and I, as she mentioned, we've put together a resource that will go with the webinar that looks at how you can get started with doing some mindfulness, putting together your sensory toolkit to help reduce anxiety, and other useful resources as well. So that would be available for you to access following tonight. And these are just some references. I just wanted to answer one of the questions during Amanda's talk about if you're a nurse manager, you're burnt out, your team is burnt out, what could be helpful in these situations? And hopefully I've touched on some of that. I would be encouraging using tools like mindfulness, meditation, not just at home, but in the workplace. Is that possible to incorporate on a work day? I would look at sensory tools as well. So I know we can have our individual sensory kits. We can, change our office space to make it calming, but can there be an area within the practice where your staff can retreat and have a few minutes to use some sensory tools to calm themselves before they get back out there and see their patients, rather than back to back, feeling disconnected from everyone and not having a break.
Cheryl?
Yeah.
Is it all right if I just say something there?
Yeah, sure. Yes.
An important part of burnout is also about doing less where you can. I'm aware that we've got work responsibilities, and it's important for everyone that we look after the people we work with as well. But often we move in to do more to try and make things better. But with burnout, it's actually also doing less where you can. We do need to rest. So finding time to do nothing at work and to rest at work if people are in burnout, and in personal time as well. So making that space.
Lovely. Well, there's lots of really positive responses in our questions, just basically thanking you both for your time. And I think it's really highlighted how important it is to focus on our own well-being, which is really important over this time, because I know it's incredibly stressful out in primary healthcare at the moment. We do have the PDF that Cheryl's mentioned that her and Amanda have provided for tonight, and that will be attached to the website, the Goodfellow website with the webinars. We have a lot of questions regarding primary healthcare updates and funding and things. So we have Christine McIntosh, who's joining us here tonight to answer some questions that have been asked throughout. Hi, Christine.
Thanks, Katie, and thanks, Cheryl and Amanda. I've got to admit that's the first time I've sat calmly for a while, despite trying to manage questions and things like that. So it was like a little mind holiday. It was really great, thank you. And I think it is important at this time that we do acknowledge what we can and what we can't do. And I'm the first one to acknowledge I don't have any slides tonight because I had to prioritise my time today. So I'm going to talk through really some of the questions that have been coming through and some of the things that are on top of people's minds. And I think that what Cheryl and Amanda have been talking about today are really important. We're really sitting now just coming over what we hope is the peak of our first Omicron surge. And so we are all feeling pretty stressed and stretched and a bit frazzled and trying to do a million things every day. So I think it's really good at this time to firstly cover off the thing that's on top of everybody's mind, but then just to talk a little bit more about some of the other things. There's a lot of concern out there around the funding, and things did not pan out as we'd predicted. And look, the pandemic has thrown this to us all of the time. It's a constant time of change and uncertainty. What I would say is there is funding there. What we need to figure out is to find the least stressful way for primary care to be able to be funded for the work that they have done. And if you've done the work, you will be funded. We're just trying to find out the best ways for practices to be able to access that funding. And so we have taken really seriously the feedback that we've had this week around this, that you've been sending in about the various ways you and your practices have been managing the COVID work. And we're really taking that on board and thinking about the various ways that we could facilitate those ways of claiming the funding. So while it might be frustrating to wait, I also have to acknowledge that the people who are doing this work are also having their own need to isolate at home with family members or having COVID themselves. So I think it's just a reflection of what everybody's sort of feeling is, that you have to kind of manage with what you've got. You've got to make decisions as you're able to, and keep moving forward if we can. So look, we've got another meeting about that tomorrow, and we're looking to get some more information out to primary care once we have really finalised what we can offer us around the various ways to get that funding. So I do know that seems to be absolutely is at top of everybody's mind, because there's nothing more frustrating than doing a lot of work and not being sure you're going to get paid for it. So taking that on board, and I recognise that there's various ways that people have been doing that. They've been using CCCM, they've been using spreadsheets, advanced forms. and they're using their practice management system. So look, we've picked up on all of that and we're working on it. The other parts that I just really wanted to cover over is thinking about those stresses. And Cheryl, you were talking about the things that happen inside work and then the things that happen at home. And I think the problem for many people is that there's a lot of stuff happening inside work, but there's also a lot of stuff happening in home, with kids sometimes home from school and things like that. So they're needing to do their schooling from home. People are having to work from home. There's a blur between work and life balance and all those sorts of things. And that's really quite a lot to deal with. I would say it's really important that we actually look at that whole, are we in the wave, or are we using the resources of the ocean, and how are we managing ourselves? Are we too caught up in the wave to see the bigger picture? And what I would say is actually, we're at the peak of our Omicron surge by the look of it. And actually, what, we're doing pretty well, actually. So, there are a lot of people in hospital, but they're not all there because of COVID. Many of them there with COVID, because they happened to have COVID at the time. Actually, as a country and as a region, we are doing well. And actually what we're discovering is that many people are only experiencing a mild illness. And so I think we do have to put it in perspective and use the tools that we have. I think naturally as healthcare professionals, we do aim for perfection a lot, and I think we have to be realistic about what we can achieve under the circumstances. And I really think, what we've seen come through from the New Zealand Medical Association is the red letter. Practices who can announce to their PHO and to the DHB that they are under considerable pressure and feel that they need to express that concern about what pressure they're under, and concerns they might have that they may miss something in the midst of all this pressure of a big Omicron surge and the implications of that. So we've talked about that as PHOs and as the NRHCC, and we're very happy to receive those letters from you and to acknowledge them and file them, and understand that is your way of telling us that actually you're under pressure, you're in a lot of stress, and actually you're doing the best you can. And it's also a way of signalling to your PHO and to us that you might need some help. It's also really important that there's another tool called the Primary Care Resilience Tool, and that's another way of indicating to us that you're under pressure and that you might have critical staff shortages and other issues going on. And that's a way of us recording that, acknowledging that, and then helping to see what we can do about supporting you in that. I think there's been a lot of pressure felt by GPs, practices, nurses to respond to every test for COVID. The reason why we have a test for COVID is partly because of that person's well-being, but it's partly because of a public health response. And so, we have a lot of feeling like we should respond to a test that come into the inbox. COVID has built up over the last 2 years to create a lot of fear and anxiety in all of us. But actually for Omicron is actually not a hugely big deal as far as an illness for many, many people. And so I think that we do need to take on board that there are already things in place, such as the text messaging that goes out to everybody who has a valid cell phone, who has a positive test in the system, does go out, and it does tell them how to access resources and when to call for help. And if they don't pick up that text message, or they don't have a valid cell phone, the contact tracing services are actually redeployed at this point in time to ring people who don't have valid cell phone numbers and to contact people who haven't responded to that text message. So for people who are feeling a lot of pressure to do text messages, I think choose to have a little bit of reflection on that as a practice as to whether that's a really high priority. The other piece that has come into place is actually that list that you can have from your PHO, download from your PHO each day now, which identifies what's been determined by the risk stratification tool as your highest risk patients, and do use that tool because it helps to prioritize who you need to call. And it's not perfect, absolutely, but it will be right much of the time. Okay, and I think it helps to reduce the stress. You can understand what it is you need to do in your day, and I would encourage you that actually once you've done your day, don't keep doing those phone calls and things, because there are safety nets in place around that for your high risk patients. Okay, so that if you don't get to them, actually we have the whānau HQ team that will get to them. Okay, so just sort of realize there is a safety net there. So if you do need to switch off, absolutely do switch off at the end of the day. And look, the weekend there, you raise the yellow flags. The first weekend we're going through sort of phases of sort of trying to understand why people have put yellow flags there in the first place. People were getting to grips with the system. Last weekend they got through 99% of those yellow flags. Just be careful to make sure that they are appropriate, that that person really does need a call. But our clinical team did get through them from the whānau HQ perspective. So I think it's about actually being able to switch off and knowing that that's okay if you don't get to everybody, because we have safety netted around those highest risk. And, you know, acknowledging that the systems are not 100% perfect. They know they won't be, but that's actually okay. We're in the middle of a pandemic. Okay, so I think it's actually reflecting on yourselves and what is possible at this point in time, and actually preserving your own well-being is also really, really important. So I think there were a few other bits and pieces of questions that did come through. As you know, tomorrow night we go to 7 days of isolation, and I was seeing some questions there around resetting of isolation periods. So yes, actually you can't find it. To be honest, I couldn't find it if I went looking for it at the Ministry of Health data, but I've actually had some experts at hand who've told me, yes, it will. So if you started your COVID isolation today, you will not need to do 10 days, okay? Tomorrow night, it will change to 7 total days from the day that you get your positive test or your symptoms started. Some other people have asked about the auto closing of records. So there have been some updates created such that if you are on self-management within the 3CM, your record will automatically close. It has been at 10 days, but that will change to 7 days for those people who are on self-management. It just means that there's less clutter in the system. They're off the system. But for those people who are under active management, what they need is that final health check, and then it will take them off the system. Another question has been, look, but if you don't get to a final health check, don't agonize over it. You don't have to do it. We'll just clean up the system and behind you. That's fine. Don't worry about it. There's been some questions there about people who are testing positive and they're then doing multiple rapid antigen tests to confirm, in fact, that they're still positive. This is not helpful, and I agree, it's a waste of testing. However, there are circumstances with critical health workers or critical workers where it might be required, and they'll be told by their managers and employers about what they need to do before they return to work. But for the vast majority of the population, they do not need to test again once they're positive. They do their 7 days and then they are out. Just really important that if anybody else, and the testing of the household then goes to 3 days, day 3 and day 7. But if they become symptomatic, they should do a test, because that becomes their day 0 then.
Christine, it was all just on that. There was a question about what do we do about our patients who test positive on their RAT but aren't registering it, and we find out that they're positive through other means.
Yeah, absolutely. So it's helpful to know how many people are testing positive. It would encourage people to register their rapid antigen test by ringing the phone number or using the My COVID record to register their rapid antigen test. And I saw somebody there saying, you know, we find out the rest of the family are positive and they want scripts. Well, it's in their best interest to lodge that, because actually then the COVID care and the community funding will help to fund their care. So it's in their best interest to do that. And it's just really important when they ring that line, the 0800 line, that they choose option 3. That takes them to the right place that they need to register their RAT, and the wait on that line is short. If they accidentally choose 2, they end up in a longer wait line, because that's the other Healthline lines. So, but you can, I understand, and Stuart, you might be the expert on how to register an unsupervised rat. Sorry, it's out of my stream. I'm whānau HQ stream, not testing stream. Stuart's in the testing stream. You know the answer to that one, Stuart. Sorry, I haven't put my head in that space for a few days.
So you can either go through the 0800 Whakarongarau, or you can go into my COVID health record and register. I mean, things are changing rapidly, so there may even be a third way, but those are the two ways that you register.
Yeah, so I had a feeling it was going in the HealthLink supervised rat one that you could do an unsupervised.
Oh, you mean through the practice?
Yes, yeah.
Yeah, no, sorry, I was talking about patients, yeah.
Yep.
So I can also, there's a question there around cases and blood tests, and particularly after the cardiologists last week were asking about, could we get troponin Ts happening in the community? So I've been working on that, and we're looking at, so Sarah Hartnell's leading that, and we're hoping to get some point of care testing in those Red Plus clinics, so that if there are people who have, I guess, more than niggly chest pain, or just, I guess, shortness of breath that doesn't appear to be COVID related, that's where we'd refer them. So obviously continue to use ED. That's the appropriate place for chest pains. But it's just these other ones that are sort of on the margins that there's an alternative there. So there was another question just about the household contacts and unsupervised rats in the practice, and whether you can claim for an assessment. I mean, I think the first thing is that household contacts really shouldn't be going to practices for their rat tests. They've got their own ways of accessing them. And I'm not sure that, it's really appropriate to do an assessment on a otherwise well person. So you need to come to your own, manage your own conscience around that one.
Thanks, Stuart. I'm just reading a few more of the questions there. Some people are needing a few lifeboats by the sound of it, and I totally acknowledge that. It feels like we do need a lifeboat sometimes in amongst all of this. I think, I totally acknowledge it feels like that at times, and it's felt like that sometimes at NRHCC too, hasn't it, Stuart? So, there's some tough decisions that have to be made, and changes happen often, and we just have to acknowledge it's a really tough environment to be working through, living through. There's just a couple of things that people were picking up on, the probable cases. So if you have somebody who's got symptoms in a family that already have a positive case, then it's likely to be a probable case. The benefit of getting that added as a probable case, if you can't get a rapid antigen test for that person and get them registered on the system, you can request whānau HQ to add them as a probable case all the way back into the contact tracing system, which will create them essentially as a case in our system for funding purposes. Okay, so, but the preference really is that they do a rapid antigen test and go through the normal channels to be registered as a case. But if, for example, they're really unwell, you need to get them into there, then contact the whānau HQ through the numbers and health pathways and the contact details and health pathways. So that's why it is useful to register probable cases. Just a note there about the text messages. So while there's been a text message for positive cases as they go into the system, with the changes that are occurring now, there'll also be text messages at the end of their isolation periods. So for the cases, they'll get a text message at 7 days. And if they are on self-management, it will be essentially, if you're fine, you can leave. If you're under active management, it says, if you still have symptoms, talk to your healthcare person who's looking after you. So that's why that's useful to do those settings in the 3CM tool. Just a final note about remdesivir. Some people might have heard that's coming through. We've had a very active discussion about that in the clinical governance meeting tonight around remdesivir in the Auckland region is being used within the hospital system, and their intention is to make it available in the community, but we're still working through some of those details, and once we know those details, we will be publishing that in the health pathways. There was some information there, but that's since been taken down tonight, and we will be working through that and getting information out to you as soon as possible once some decisions have been made around that. Okay,
just one little thing, Christine, around probable cases, because the latest ministry advice suggests that that we actually have to test everybody, and that there are no probable cases. So we've checked with the ministry on this, and we will be able to provide some final advice, hopefully tomorrow, but I would, for the moment, continue with probable cases. Otherwise, it's just not, yeah.
Yeah, it's been a practical solution for that issue where you know somebody's unwell, you need to provide some care, and it's just not necessarily practical to immediately get a rapid antigen test out to them or whatever reason. So I think from a clinical perspective, it makes sense. So somebody's Margaret asked if we could send the examples of those text messages that go out. Yeah, absolutely. Let me get them on Health Pathways for you tomorrow. I'll sort that out. I've been given the examples of that today. The whānau HQ phone number for probable cases, you can find that on Health Pathways. So I don't know it off the top of my head. And I'm now at home finally for a webinar for the first time in weeks. So I haven't got that at the top of my mind, but please look at Health Pathways, it's on there. And the very useful page is the one that talks about local services. And other people are asking about whether or not they can submit POET claims without 3CM files. And the answer is going to be yes, because we've got a very hybrid system going on at the moment. And we acknowledge that because of the difficulties of 3CM. However, some practices have managed to go with it. They've done everything on 3CM. So, which is really, really helpful when Healthline need to provide care to them after hours. So I would still strongly recommend it, despite all the frustrations for your patients who are more unwell, because it does help to provide that continuous care, and it helps us at whānau HQ to be able to provide that care at the weekend so that you can take a break. Okay.
There are lots of questions coming in, and I know that this is a very stressful time for everyone, and people are feeling very frustrated about all this, all the funding that's going on. We are out of time, unfortunately. So thank you so much, Cheryl and Amanda and Christine and Stuart, for joining us tonight. Take care, everyone. I know it's a really hard time, and I really appreciate Amanda and Cheryl for coming in and giving us some self-care tips for us and the people around us as well.